Hello everyone, and welcome to Empowering Patients, the channel that is dedicated to supporting you step by step from start to finish of your healthcare journey. My name is Mattie. I am your guide to navigating the world of patient empowerment. If you are new to this channel, welcome. We're happy to have you. Now is a wonderful time to go ahead and hit that subscribe button and also ring the notification bell so that you don't ever miss out on important content. As always, any links or resources mentioned in today's video can be found down here in the description box. Let's jump into today's video. When you make an appointment with your doctor or get an X-ray or an MRI to address your shoulder pain, the report is going to reference any number of bones, joints, muscles, and ligaments to help diagnose your injury. It can be immensely helpful and empowering to have a basic understanding of the anatomy of the shoulder to help keep you informed, understand your medical condition, and make an informed decision. So today we are going to go through a very basic anatomy of the shoulder, as well as areas that are most commonly injured. Let's jump in. The shoulder is often called the shoulder complex or the shoulder girdle, as it is comprised of a series of bones, joints, and muscles. The shoulder has 4 joints, 3 bones, and 8 muscles. We are going to start at the bottom level, which are the bones. The bones of the shoulder include 1, the clavicle. The clavicle is located right here. This teeny tiny bone, also known as your collarbone, has a big responsibility as it is responsible for connecting the front of your arm to the base of the front of your body here at the sternum. The second bone is the humerus, or often called the upper arm bone, which is located right here. The third bone and the largest bone in the shoulder is the scapula, or better known as the shoulder blade, which is located right here. Shoulder blade is a very misleading name for this bone, as it is so much more than a triangular shaped shield on your back. On that scapula, there are also other smaller bones on the outside that are major connection points for other muscles, ligaments, and tendons in your arm. The scapula also houses the glenoid cavity, or the socket, that is responsible for all of the most major movements in your arm. The most common points of injury at the bone level in the shoulder are 1, a clavicle fracture. This tiny bone is involved in almost all major movements of the arm. If you take your hand and put it here on your collarbone and move your arm around, you can feel that this tiny bone is moving the entire time. So a fracture of this bone can lead to pain and discomfort with almost any movement in the arm. The second most common bone-related injury is a fracture of the humerus, and that fracture can happen anywhere between the top of the bone at the shoulder all the way down to your elbow. Think of your humerus as sort of like a bus stop. This is a major connection point for several muscles of the shoulder, the chest, and the back. So depending on where that fracture and the humerus are, it can lead to pain, discomfort, and restrictions in how you're able to move that arm in a number of different directions. The places where all of these bones connect is called a joint. These joints are named after their connection points. As we mentioned before, there are 4 major joints in the shoulder. The first joint and the most significant is called the glenohumeral joint. This is located right here, where the top part of your humerus, or your upper arm bone, meets up with that glenoid cavity or socket here in your shoulder blade. This is considered a ball and socket joint. So the head of my humerus is a ball, the glenoid cavity is the socket, and this is where all of the major motions of your shoulder occur. Your glenohumeral joint has the most range of motion in any part of your body. Inside that cavity, there is a tiny layer of tissue that's called a labrum. This is a layer of soft padding that is responsible for keeping your upper arm in the correct position and also making sure that that movement is smooth. The second joint is called the acromioclavicular joint. This is responsible for connecting the front part of your shoulder blade. There's a little offset bone called the acromion to your clavicle or your shoulder blade. That joint is also right here. The third joint is called the sternoclavicular joint. It is responsible for connecting your clavicle to your sternum right here at the front base of your neck. So that joint is right here. The fourth joint is called the scapulothoracic joint. This joint, it's kind of like the Pluto of joints. It's not really a joint, it's more of an honorary joint, and it is responsible for being the spot where the back of your shoulder blade rubs up against the back of your rib cage. So it's this area right here. The most common injuries at the joint level include shoulder dislocation. This is where the top part of our humerus actually separates from the joint itself, leaving a gap. Second is arthritis. There are many different forms of arthritis, but arthritis is described as swelling or inflammation inside the joint. Arthritis can also lead to the wearing away of the soft pillowy cartilage that lines our bones, leaving a rubbing sensation. Sometimes people describe that as bone-on-bone feeling. Arthritis can cause pain, swelling, and decreased range of motion in the joint that is impacted by arthritis. The third most common joint injury is a labral tear. Earlier we talked about the labrum being that cushiony lining on the inside of that glenohumeral joint. Sometimes that lining can cause a tear. This causes also pain and swelling, and some people describe a popping sensation when they move their arm when that injury is present. There are 8 muscles that make up the shoulder girdle. If you think about what an actual girdle does, they provide support and help hold things together. Muscles do the same thing. They attach to your bones using a series of tendons. They provide support of the joint, and they also control the movement that occurs at that joint. Within those 8 muscles, the 4 most important are the muscles that make up what is called the rotator cuff. The 4 muscles that make up the rotator cuff include 1, supraspinatus. Supraspinatus is located right here, and it is responsible for attaching the top of your shoulder blade to the top part of your humerus. Supraspinatus's major responsibilities include a motion that we call abduction, which means moving your arm up and out to the side. Second is infraspinatus. It is located right here. Infraspinatus is responsible for attaching the outside part of your shoulder blade to the back of your arm. Its major movements include external rotation, which means turning our arm away from our body, and a movement called scaption, which describes the movement our shoulder blade makes when we move our arm up and to the side. Third rotator cuff muscle is teres minor. It's located right here. Teres minor attaches the bottom part of our shoulder blade to the back of the humerus. Its primary movements also include external rotation and what we call adduction, which is pulling your arm back in towards your body. The last muscle in the rotator cuff is called subscapularis. This one is a hard one to see because it is actually on the underside of your shoulder blade, and it's located way back here. This is subscapularis. Its primary responsibility is internal rotation, which means pulling my arm in towards my body, and also adduction, pulling my arm back down to my side. The other 4 muscles that are part of your shoulder complex include the rhomboids. Now, the rhomboids is actually a series of 2 muscles, rhomboid major and rhomboid minor, so they count as 2. Their job is to help connect the back of your shoulder blade to the upper part of your spine. Rhomboids are located right here. Their function is to help coordinate the movement of the shoulder blade with other movements of your arm. The next muscle is trapezius, often referred to as your traps. This is a large triangular shaped muscle that connects the back of your shoulder blade to the upper and middle part of your back. So the traps start here and connect here and then down here. Their responsibility is to help raise and lower the shoulder. The last muscle that's included in the shoulder complex is called the deltoid. The deltoid fits kind of like a cap sleeve on the top of your shoulder. It's located right here. The primary function of the deltoid is to help with elevating your shoulder and bringing your arm out to the side, and it's also a helper muscle to help coordinate other muscle movements. Another important function of the deltoid is that this provides the most support to your shoulder capsule to help prevent dislocation of the arm. The most common injury at the muscular level is the rotator cuff tear. This happens when there is a small or large tear in any one of the 4 rotator cuff muscles that we just discussed. The pain or challenge in range of motion or movement of the arm is very closely related to the action that the torn muscle was responsible for. In addition to the bones, joints, and muscles that support your shoulder, there are several other kitchen helpers that are around to help those chefs for a smooth service. Each muscle is connected to the bone by a tendon. A tendon is basically a thick string made up of fibrous material that is responsible for connecting the muscle to the bone that it is assigned to move. When there are injuries at the tendon level, this can lead to pain, discomfort, and a decreased ability to move your arm. Ligaments are responsible for connecting one bone to another bone. When those tendons and ligaments intertwine to surround a joint, that's called a joint capsule. I mention all of this because there are many injuries that can occur at the tendon, ligament, and capsular level. The first common injury is the frozen shoulder. This happens when the tissues surrounding the shoulder joint become thick and stiff, causing a decreased ability to move your arm. The next is tendonitis. Tendonitis is when the tendons that connect the muscle to the bone become inflamed. This can cause pain, swelling, and decreased ability to move the arm. Some people also report a rubbing sensation in the joint with tendonitis. The third and last injury that we're going to discuss today is a tendon tear or a tendon rupture. This happens when there is a tear in the tendon that connects the muscle to the bone. Tears can either be partial tears or a complete tear. Thank you so much for joining us today on Empowering Patients as we journey through the anatomy of the shoulder. Feel free to click the link below to our blog in the description box for more information so that you can review all of the information that we discussed today. If you have questions or topics that you would like us to discuss in the future, please leave a comment in the box below. Your feedback is so valuable to help us develop the content that you value most. If you found today's video helpful, please feel free to check out our other videos in the series as we help you through your entire journey with your shoulder injury. If you haven't done so already, now is the perfect time to go ahead and click that subscribe button and ring that notification bell so that you don't miss out on any of our future content. Thank you so much for being a part of our Empowering Patients community. Remember, your health is your wealth, and we are here to empower you every step of the way. Thank you so much for joining us. Until next time, I'm Mattie. I am wishing you health, happiness, and empowerment, and we'll see you next time.